Okay, well, thank you, Louise, for that introduction. As Louise said, I am a nurse, but I'm also a socialist. And I'm a socialist because I'm a nurse. And I'm a nurse because I'm a socialist. Now, I could stand here and tell you heart-wrenching stories full of gory details about the reality of working in an overstretched, understaffed, underfunded NHS. But I'm not going to do that, partly because my employers take quite a dim view about that sort of thing, but mostly because I don't like that narrative. I don't like that narrative because it paints us as staff and you as patients as victims who are powerless to do anything about it. And I think what we need to do is break that narrative. There was nothing powerless about when the junior doctors overcame the small c conservatism of the British Medical Association and organised the largest strikes the health service has seen in a generation. There was nothing powerless about on the 4th of March this year when a quarter of a million of us marched on Parliament demanding an end to cuts, closures and privatisation, an end to pay restraint for NHS staff and for a fully funded, publicly owned, publicly provided national health and social care service. And if we get served up a paltry, insulting pay offer, even if it is technically beyond the 1% pay cap, if we get offered an insulting pay offer from our employers, there will be nothing powerless about strikes organised up and down the country in the NHS. In fact, what it will do is it will demonstrate to us as NHS workers and to the wider public who is it who really runs the National Health Service, who is it who really runs the country. Now, I am not naive, and I don't think anybody else here is too. The crisis in the NHS is great. The assault takes place on many fronts. So not to put too fine a point on it, it doesn't stop with one strike. It doesn't stop with one demonstration. It doesn't stop with one judicial review. I don't want to overwhelm you. I don't want to make a mountain out of a molehill. But what we effectively have to do is to bring down this government. I'll finish with this. We don't want to bring down this government just so we can replace them with the same people, with the same policies, just different coloured ties. We want to bring down this government and replace it with a government that has policies committed to reversing cuts and privatisation, committed to building a health service integrated with social care on the basis of public ownership, and it is forced to make those commitments because it has been put there by an army of people just like us, NHS workers, NHS campaigners, standing together in solidarity. Thank you.